Okay, so we're here again with Laura Kane, CLM of CP4 and 3C, who will show us a little bit more about the quality check process through her area improvement huddle board. Laura, can you take us through how you sustain and maintain improvements through the quality check process?
So we use the quality checks as part of our improvement huddle by ensuring that the new improvement opportunities have been maintained and that there's some sustainability to our improvement opportunity ideas. So what we will do is we will take, for example, isolation carts, which was identified as an improvement opportunity by our infection control practitioner, Karen, was that we didn't have enough dedicated isolation carts for each isolation room. And this was identified as a problem because there's the potential for contamination when we're putting the yellow gowns on the regular linen carts, and staff don't have the equipment right there to be able to go in and out of the room. So there was decreased staff satisfaction having to look for gowns, as well as patients and families wouldn't be compliant with the isolation because they didn't have the equipment to go into the room. So we identified it as an improvement opportunity. Karen worked with some of the staff members to develop some standard work regarding the isolation carts, and so all of the staff know what should be on the carts and what should not be on the carts. And then going forward, we ensured that all of the isolation rooms had carts. So we implemented it as a quality check to ensure that for a month, to make sure that going forward we are sustaining this improvement opportunity. So we would do a quality check on that improvement opportunity, and the check would be done so that just one person would quickly make sure and ensure that all of the rooms had isolation equipment. We identified why we were doing this quality check, and then every day we would identify whether it's green, 100% of the isolation rooms have dedicated equipment, or red. We came across some rooms for that as well. So we did very well the first week. We had 1 or 2 days that were red, and then since we've improved that opportunity, 100% of the rooms have had isolation cards stocked for those rooms.
Great. What would you say is the hardest thing about using this process to sustain improvement?
I think the hardest thing originally is trying to find the dedicated time to do the quality checks. One of the things that we were concerned about was that it was going to be very labor intensive, but it hasn't been. We've initially, either the CRL or myself would do the quality check, and now the charge nurses have been participating in the quality checks. Or we might just do the quality check as part of the huddle when we have all of the staff. We might just check whether or not all of the rooms have isolation cards.
Great. Could you just mention, I see 4 cards, these are the quality check cards, and isolation cards being one of them. Could you mention briefly the other 3 that you have and you're monitoring right now?
Sure, the other 3 that we're currently monitoring is that the bedsides have patient names over the heads of the beds, and that was identified from one of our new staff members that came to the unit and noticed that a lot of our patients don't have the names over the beds, and dietary was having some challenges delivering trays. Another thing was that the med carts had patient names on it, and we were using the patient addressograph stickers, which had the address on it. So we kind of identified that we shouldn't be doing that, and we should have another system in place. So since we've done that every day, we take a look to make sure that all of our patients have the names over the beds and that the med carts are properly named using the correct labeling system. Another improvement opportunity was oxygen and suction equipment at the bedside. And we found that a lot of our rooms did not have the canisters in place and the suction in place, and that they'd just gone missing over the years, and that nurses were running around and taking from one room and using on another. So we did provide the equipment. We got the RTs to come in and help us with that so that we ensured that we had enough equipment to complete this improvement opportunity. And then we made sure that it's really the nurse's responsibility to ensure that that equipment's in place, and then we just continue to do quality checks to ensure that every bedside has the oxygen and suction equipment as needed.
That's great.
Another one was identified as our physician, and this was documentation of bowel movement on the Cardex and the 24-hour flow, and we're just ensuring that 100% of the patients have that documented. And I think that this was information that the nurses would have, but it wasn't being documented in a consistent spot. So we've all decided that the spot that we wanted to use would be the Cardex, and now we're still trying to move forward with this, and we're getting up to about 85%, but we're still red. There's still a couple patients that are missing, but every day we talk about it in rounds, and I think that we'll be 100% green every day. So it's a good opportunity to remind staff and go back to ensure that it is being implemented.
So last question, Laura, and thanks again for your time. What words of advice would you have for another unit or other leaders in this approach to sustaining improvement?
I think the quality checks are a nice tie-in to the work that we're doing, because the staff can see that we are dedicated to making sure that the ideas are being sustained. One of the things that once the improvement ideas have been implemented, to take them off the board, you don't really know, like we may have done it for a week because it's fresh in our minds and we've talked about it and everybody's on board, but to make sure that the process has sustainability, if you do the quality checks for the month, the staff know that we're dedicated, not just fixing the problems for the moment, but having sustainability and making sure that the improvement opportunities are being completed.
Okay. Thanks so much.
Is that it? Do you want